of trying to describe the experience and the wealth of knowledge that Catalina brings us to the summer school. So I think I'll hand over to Catalina, and I just an announcement with regard to the response. Andrew will be here to give a response to Catalina's keynote, but unfortunately Sharon McLean, due to health illness, could not attend, so she won't be giving a response. Okay, Catalina.
Just let me see if it's working. Yes, it's working, I think.
Yeah.
Well, first of all, thank you very much for inviting me to be here with you today. I'm sorry I'm here. I feel like I'm hiding behind the flags. No, I'm too little. I'm going to make a formal claim because I don't see the Costa Rican flag. So, but it is a great pleasure and an honor for me to be here with you today. I never thought in my life that I was going to be doing a keynote speech at the Galway Summer School, which is famous all around the world and is having one of the highlights of the year in terms of human rights and disability. This center was actually the first place I visited after being designated as a special rapporteur. Some of you I met by then, and 6 months later, 6 intense months later, I'm happy to be here because I think it's a right place to do a little bit of recap of what has been happening in the mandate in over the last 6 months. I also apologize in advance to the person who is doing the card services because I know that it's going to be challenging to follow with me. In any case, this presentation gives me a great opportunity to share with you some of my first impressions and lessons learned, but also to present to you some of the questions and concerns about how I believe and what I believe are the most pressing issues to advance the rights of persons. You want me to use the mic, the normal regular mic?
No, carry on.
Okay. Sorry. So it's a great opportunity, as I was saying, to also present to you with the most pressing issues to advance the rights of persons with disability broadly, but also specifically in the context of the post-2015 development agenda. Your advice, your guidance on how to implement the CRPD is invaluable. The role that the academia can play and must play and is playing in providing solutions for the challenges around persons with disabilities' rights is crucial to promote policies and actions that are truly in line with the principles of the CRPD. So I really hope that this week, as has been mentioned, will serve to connect academia with the real challenges that we're facing in implementing the CRPD and in including persons with disabilities in the development agenda. But first, allow me to start with some reflections about the mandate of the Special Rapporteur. First of all, I would like to touch on what is the relevance of this mandate of the Special Rapporteur. As you may know, this is the first mandate created under the Human Rights Council to promote the rights of persons with disabilities. The mandate was created a year ago, and the designation was made a few months after I started my work in December last year. The mandate comes with a strong recognition of the human rights system and the UN system as a whole, that despite all the achievements that we have made since the adoption of the convention and with the adoption of the convention, much more needs to be done in order to include persons with disabilities meaningfully in our communities. The mandate becomes then a great opportunity to mainstream persons with disabilities' rights, to mainstream, to go beyond the efforts we do outside the disability community and get our voices or needs in the mainstream community. It gives us an opportunity also to directly support states, to provide capacity, to provide technical assistance and to support processes of capacity building and to support state efforts in implementing the convention. It gives us an opportunity for dialogue and exchange of good practices. I think that we are doing a lot of efforts, and most of them, and a lot of them have been mentioned here, but we are not being as good in communicating and exchanging information on what we are doing. The mandate is also universal. That means that we can work beyond countries that have ratified the convention. So I don't have to, and the special rapporteur in the future is not limited to work with countries that have ratified the convention, but could actually support the efforts of countries that have not ratified the convention. Of course, the convention is the highest standard and should lead any effort in the promotion of the rights of persons with disabilities at international and national levels. But the opportunity of working together with countries that are in the process of ratifying or have not ratified is also something very important that comes with the mandate. Besides the default duties that the mandate holder has to create thematic reports to the General Assembly and to the Human Rights Council, to perform country visits, and to collect information on human rights violations and do communications with states. The mandate also gives us the possibility, and the mandate mandates, to facilitate the provision of technical assistance and capacity building, to promote gender equality, and to promote inclusiveness. And I think this is also key of the mandate. This is about all persons with disabilities in all parts of the world. We have to talk about all kinds of impairments and persons with disabilities facing all kinds of discrimination, indigenous persons with disabilities, people living in rural areas, persons with different types of impairments that create multiple grounds of discrimination. We also have in the mandate a clear references to inclusive development, the post-2015, and international cooperation. So the role of the mandate holder is also to promote inclusion of persons with disabilities in those areas. What is my vision of the mandate? While we have very concrete thematic areas, and it's very broad, as you can see, I think that the mandate was created with a clear vision to, with a clear call to bridge building, to facilitate cooperation, synergies, and exchanges, and to advance in a coordinated and national appropriated manner. So the mandate is also aimed to avoid duplication, to avoid duplication between multiple efforts, and to make the best of those efforts. And also, as I said, its mandate to go beyond the disability community, to help us mainstream the rights and needs of persons with disabilities in the global community and the global agenda. As you see, the magnitude of the duties is huge. We have to make alliances, we have to make dialogue and consultation, and we have to make prioritization, in order to take advantages of the opportunities that the mandate brings with it. So I started by doing alliances with the center, for instance, trying to get the center's capacity to support the mandate and to bring what the academia is doing, to inform policy development in the ground. I started consultation with several stakeholders to understand where are the main challenges in terms of implementation of the CRPD. And by doing that, I have identified three main priorities, or three clusters in which I think that we have to work. And these clusters are mutually reinforced. No cluster is more important than the other cluster, but on the contrary, and I think as Eleanor mentioned, it brings, the convention reflects the importance of having an approach of development, an approach to human rights, and this, I believe, is reflected in these clusters, which are poverty reduction, building citizenship, and embracing human diversity. When I say poverty reduction, I think it's important because we know it's one of the main challenges persons with disabilities face around the globe. And this is important to highlight because poverty is not only a Global South issue when it comes to persons with disabilities. Actually, poverty is a global issue when it comes to persons with disabilities. Poverty is a very democratic factor when we talk about persons with disabilities. We're also talking about building citizenship, and why? Because the challenges of exercising legal capacity, making decisions, participating in political life, living independent in the community, are one of the main challenges when it comes to implement the convention. And I'm also talking about embracing human diversity because unless we're able to raise the awareness and understand that impairments are part of human diversity and that disability will only be prevented by eliminating the barriers and participate and to be fully included in the community. We are not talking about we will not eradicate disability. We have to understand that disability and impairment is part of the diversity and that we have to embrace it and we have to be proud of it. When it comes to disability and inclusive development, I think that we cannot be thinking about disability and inclusive development if we don't touch all these elements that the convention brings about. The convention is a very strong tool in terms of the development side, but also the human rights side. And the great contribution of the convention, I believe, is that it eradicates that false notion of the divide between the development and the human rights world. We have a tool, a tremendous tool, that has proven that human rights are central to development, and that development is central to human rights, and that we cannot continue to have these two different worlds, one in Geneva, one in New York, one in the World Bank, and one in the European Court, talking about different things. We should talk about the same. We are not talking about different categories of human rights, but we are talking about human rights. So there is this fake divide between the human rights-based approach and the development approach, and this is not longer sustainable or acceptable. The CRPD brings a lot of innovations, and it brings new conceptions on how we should approach disability and inclusive development. It has, of course, clear references and specific articles, such as Article 32 on international cooperation, which clearly states the need of considering persons with disabilities both as agents and beneficiaries of development. It refers to the need, and I think, of increasing funding and mainstreaming international cooperation efforts so that we don't only get a specific funding for disability-specific projects, but we make it to the big money. We get included in the mainstream programs that are trying to tackle the main development issues all around the world. And for that, it will be important to make a call, and having the opportunity of having the ministry here to make sure that the outcome document of the Addis Ababa conference includes explicit references to persons with disabilities, and I know that there is already good efforts in that regard. Then we have Article 28 on inclusive social protection for active participation of persons with disabilities, and I believe that it's also a central part of the convention, not only included in Article 28, but in Article 25, 24, and 27, and 19 of the convention. We need inclusive social protection. We need social protection that it's going to aim for social participation. We need to change, and the convention mandates to change the way in which social protection has been conceptualized. Social protection now should be a tool to include persons with disabilities and to allow persons with disabilities to participate. Traditionally, social protection was used to foster segregation of persons with disabilities, but now we have the challenge of transforming that and using social protection as a tool to include persons with disabilities and the agenda and their communities, to foster their participation. And I believe it's one of the strongest tools we have also, and I will refer to that later, to include persons with disabilities into the development agenda and the post-2015. Also, we have Article 19, which is a core article. It's, I believe, a new right, and it's open to discussion, but demonstrates how interlinked the rights are. We're talking about independent living, we're talking about participation, but none of that can happen unless we have the basic services, accessible services, unless we have coverage of the disability-related needs. If that doesn't happen, if we don't have the rights to have the basic needs covered, we're not going to be able to participate. If the community doesn't make the arrangements to have accessible services and affordable services, we're not going to be able to participate. So this is how we see that the political participation, the legal capacity, the independent living is strongly linked to social protection. When it comes to the SDGs, and I'm also very happy to note and to acknowledge the role that Ireland has been taking in co-chairing the work on the adoption of the new SDGs, we're talking indeed about a new social contract, a new global pact, a social contract that is inclusive of all countries. I think that it's also important to highlight that the SDGs are not only about Global South. The SDGs promote the change and engage all countries, developing countries are obliged and are mandated to make special efforts to include all persons in their development efforts. So this is about all people in all parts of the world. And this creates a really new global pact, a new agenda. And the CRPD became, in that regard, a very important tool for us to be included in that development agenda, to be included in this new global pact. We had a strong tool that had allowed us to bring visibility to the needs and rights of persons with disabilities, and we have used that tool, I believe, quite effectively. We have to make sure that the three pillars, and we have been making efforts to make sure that the three pillars of the Sustainable Development Goals, that it's sustainable and inclusive economic development growth, social development, and environmental protection, are inclusive of persons with disabilities. I believe that after the CRPD adoption, the SDGs is perhaps the greatest opportunity we have to meaningfully advance the rights of persons with disabilities at global level. But also, this is not only about how are we including persons with disabilities in the global agenda, but how we from the disability community are contributing to the global agenda to make it more inclusive for all. And we have to be careful and be mindful of those two aspects. While we are promoting inclusion of persons with disabilities and recognition of the rights of persons with disabilities and the needs of persons with disabilities, we are also fostering a more inclusive global agenda. If we recognize and we include persons with disabilities, we will make sure that we include everyone. Persons with disabilities are present in every segment of the population. We're indigenous, we're women, we're girls, we're children, we're older people, we're rich, we're poor. So if we consider disability as a main factor, we will contribute to make sure that every action will take into account every person. And the idea of that inclusive and accessible development will benefit all, but not only persons with disabilities or marginalized populations. The CRPD, as I said, has been a tremendous tool and has made the difference between the new post-2015 development agenda and the MDGs. Before in the MDGs, and you know it very well, persons with disabilities were totally absent from the picture. Thanks to the CRPD, we have been included, and now I know that you're familiar with the new text and the zero draft and the 7 references we have and the specific targets, specific language on disability, but also the several language on inclusion and participation, leaving no one behind, etc. We have references in the declaration, in the draft declaration. We have references, as I mentioned, in the output document of the Financial for Development Conference, including references to the need to provide social protection for persons with disabilities. But we have to make sure also that all these references will be made and the efforts to implement the new agenda will be made in a CRPD compliant manner. I guess that one of the biggest challenges now is to make sure that those references that we are achieving in the process and that we hope that we will maintain and that will be adopted in September at the high-level segment of the General Assembly that will adopt the SDGs, once we move towards the implementation and the follow-up of this new agenda, we have to make sure that the efforts are going to be made in a CRPD compliant manner. We have to make sure, and I believe that that was also mentioned, it is imperative that the 3 pillars of the Sustainable Development Agenda are achieved through specific actions which are inclusive of persons with disabilities. and so that we make sure that no target will be considered met unless it is met for all, including all persons with disabilities. We have, of course, although we have achieved a lot of stuff, in the disability community, we want it all, and we wanted it by yesterday, not by today, but by yesterday. So we are not as totally happy with what we have. We see the challenges ahead, and we are very concerned about the follow-up and review processes, about the processes of indicators and national implementation, about how are we going to transform the the SDGs and policy development and action in the ground. How is this going to be reflected in the data collection, and what are the next steps? And so let me talk a little bit more about these challenges. The first challenge is the follow-up and review. We need to achieve implementation of the SDGs, now that we have achieved the references. We need to have a strong implementation framework, both at international and national level. The international level should include all the human rights system, the UPR, treaty bodies, but also the specific monitoring mechanism that will be created, the follow-up mechanism that will be created through the high-level political forum. But this all has to be coordinated. The human rights bodies need to include the SDGs as indicators for achievement of human rights. And the high-level political forum needs to include human rights indicators when they are monitoring the advancement in the implementation of the SDGs. We also need national level implementation and coordination mechanisms to measure the advancement on the Convention on the Rights of Persons with Disabilities, and these mechanisms must extend its scope to incorporate the post-2015 development agenda. And on the other hand, we also need that the national level mechanisms that will be established for implementing the post-2015 development framework are inclusive of persons with disabilities, are addressing the needs of persons with disabilities, and promote the active participation and consultation of persons with disabilities and its organizations. Moreover, it is also important that indicators that track progress disaggregate data by disability in order to provide greater certainty about the impact of the measures and programs on persons with disabilities. So we need indicators, we need international indicators, we need national and regional indicators, we need specific indicators, we need indicators that can be measured by disaggregated information, and we also need, and it's important, to make sure that the new indicators will not discriminate against persons with disabilities, because we can also have some indicators that may exclude persons with disabilities may result in excluding persons with disabilities from participation. So we have to be vigilant both of having a specific reference, having disaggregated indicators that could be disaggregated by disability, but also we have to make sure that we don't have indicators that will result in the exclusion of persons with disabilities. We have a big challenge in how to transform this international agenda and policy development. How are we going to do to create the link between the political declaration and the actions in the ground? I think that that is a challenge when it comes to CRPD implementation, and that will be the main challenge when it will come to SDGs implementation. We need to make sure that we translate these policies, this political declaration, and concrete measures and policies. And I believe there, and sorry if I will speak a lot about social protection, but I believe that social protection can also play a fundamental role in addressing the needs of persons with disabilities on the post-2015 development agenda. I believe that there is an increasingly larger consensus on the importance of including persons with disabilities in social protection systems in order to combat inequality, vulnerability, and poverty. In this context, social protection can be an important instrument for pursuing several of the goals For instance, of course, ending poverty, ensuring healthy lives and well-being, ensuring inclusive equity, quality education, promoting lifelong learning and opportunities for all, and promoting full and productive employment and decent work for all. Ending poverty in all its forms for persons with disabilities, it's a goal that should be addressed in the short term by mainstreaming disability in social assistance and poverty reduction programs. If we don't make it to poverty reduction programs, if we don't have specific references to persons with disabilities and social protection and poverty reduction programs, it's going to be very hard to meet the goals of poverty eradication. We have also a challenge in data collection, and I think that's also one of the challenges in which you can play a fundamental role. Although there are a lot of efforts in collecting data of persons with disabilities, and although the Washington City Group has made important advancements in how to collect data of persons with disabilities, and thanks to that, we're able now to disaggregate data. There is still this challenge of making sure that the UN system and that the states are in line with us and believe that we can now disaggregate data on disability. The main response that we're getting, it is too complicated. We cannot do it. Although there are clear references in some of the documents that the UN has already produced, and the explicit target 1718 on the need to collect data that can be disaggregated by disability, we still have agencies that are reluctant to do that, and countries that don't want to engage in the processes. It is important to create more support to efforts on data collection, to engage in alliances with the UN agencies, to work with them and show them that yes, it is possible and that this is not an excuse for inaction. I believe that even though we need better data and we need to make efforts to get more data, this is not an excuse for inaction. We have to make sure, and we have, and the academia has the tools to advance in a way that with the information we have now, we can move towards implementation of the SDGs and to get the machinery moving. Even though we need more efforts, it is quite clear that even some of the actions, for instance, in inclusive societies, inclusive cities, we don't need to have data to start working. But even in those that we need the data to start working, we have the data. And in a recent meeting I had with the Washington Group and the ILO in Geneva last week, where several stakeholders were there sitting from the disability community point of view, it is possible. So we need to just bring the arguments from the academic point of view so that we can work on that. We have other steps, and we have other challenges in how to promote the inclusion of persons with disabilities and the development, and it goes beyond the post-2015 development agenda. We have next year the World Humanitarian Summit, and we need also to make sure that we start engaging with the discussions about how to include persons with disabilities and the humanitarian response, not only in disaster risk reduction, which is important, and we saw important advancements in the last Sendai conference last March, but also about how to tackle the needs of persons with disabilities when it comes to the response of situations of armed conflict. What are we going to do to respond to the needs of persons with disabilities that are affected by armed conflict? But more than that, and because I don't think I have provided any kind of response, what I would like to do is to pose some questions to you. I believe that this week will give us the opportunity to discuss about these questions and to see how we can be more effective to advance the agenda of persons with disabilities in the global panorama, in the global picture. I guess that there are questions that we should be very frank about it, and we should ask ourselves, are we in the position to accompany the process of follow-up and review of the SDGs? Are we as academia ready to follow up this process and to provide the input that is required to advance? Can we support the development of CRPD compliant policies at national level? Can we support national efforts to develop policies that will be compliant with the CRPD and that will help us further inclusive development? Are we being able to outreach the policymakers? Are we talking to them in a way that is effective? Are we communicating our messages in an effective manner? And this is important both at national and international level. So are we talking to national policymakers, but also are we talking to international policymakers? Are we getting engaged with the international financial institutions, for instance? Are we supporting the capacity building of civil servants? One of the major gaps that I have identified is the lack of understanding and lack of capacity of the states in implementing the CRPD. There is a lot of political will, but there is a lot of lack of understanding of the innovations that the CRPD brings along. So are we in the position to accompany the process of capacity building of those public servants that are working directly on the implementation? Are we able to support the processes of capacity building of DPOs and persons with disabilities? Are we going to be able to allow them to engage in a meaningful way in the national processes of implementation of the SDGs? Are we going to be able to promote their participation as agents and beneficiaries of development? Are we inclusive of all persons with disabilities? Are we making sure that we are not leaving anyone behind in our efforts? Are we supporting the capacity building of other human rights and development experts on the CRPD? This is another challenge that I have faced. I believe that within the disability community, we are already getting into this point of we're very comfortable with our discussions. And some of the feedback I am getting is that, oh, whoa, you're moving way too fast. We are not being able to follow the discussions that the disability community is having. So the mainstream human rights community is not engaged in the same way in the discussions that we have. Are we making efforts to proactively engage other human rights experts in these discussions? Are we building a strategic alliance? And this is very related to that. Are we working together with NHRIs, with other human rights treaty bodies? I'm sorry, it's good. I was so concerned about it. I had so much time that I couldn't spend. But it's time. So I think that those are the questions for me, and I will finish with that. We need to be more strategic to get the disability word out, to get it out of Galway and to make it to the real world in the national context, to make a difference in the life of persons with disabilities. Once I was in Mexico and I read a quote that I liked very much, that I think it's anonymous. I haven't found the source at least. But it was this, and I tried to translate it. They made a small circle to let us out. We then built a bigger one that could feed us all. I hope that we can make that effort here together, and I thank you for the opportunity. I'm curious to see.
Thank you very much, Carolina.
I apologize.
Not at all. I think the Minister is just going to leave us now. Thank you, Minister.
Will you send me a copy of that?
Okay, our next speaker is Andrew Griffith from Sightsavers International, who's going to provide a response to Catalina.
Great, thank you. And yes, I'm absolutely delighted to be here in Galway, and thank you so much for the welcome. So just to introduce myself, so I'm Andrew Griffith. I'm the head of advocacy at Sightsavers, and Sightsavers is a disability rights and avoidable blindness NGO. We work in sub-Saharan Africa and in South Asia. I'm also the co-chair of Beyond 2015, which is an international campaign of 1,300 civil society organisations working in about 135 countries. And we've come together wanting to make sure there is a civil society voice is strong within the post-2015 process. I'd like to make it really clear that I am in no way qualified to speak after someone as eminent and excellent and experienced as Catalina. She's a central player in the important job of promoting the rights of people with disabilities. So I'm also here to pay a bit of homage to her work. I'm also delighted to be speaking after the Minister who's had to go before hearing me. But as he said, Ireland have played a really important role in the post-2015 agenda. And I've lived that agenda, frankly, for the last few years. So I want to pay my thanks to the Irish government for the work that they've done. So I'm tasked with responding. And I'll do so from my experience of engaging with the post-2015 agenda. I work very closely with the International Disability Alliance in New York and the IDDC, and we work very much on a shared agenda. And I'll be talking about how we in the post-2015 negotiations are using it as an opportunity, I think, for promoting disability rights, but also to importantly touch on the wider context. I agree completely with what Katina said. It's important to see the impact of the inclusion of people with disabilities on the whole agenda. People with disabilities have a huge role to play in sustainable development, and lazy discrimination has meant that potential has not been tapped. And that's a really important message to give in terms of post-2015. So where are we in post-2015? A lot of this has been touched on. We're a long way down. For most of us, it's been about 5 years of joy, pain, I'm not sure. But the agenda is about what should the world look like in 2030? I mean, it's quite a big question. And so it demands quite a big response. And so what we've had is 5 years of consultations, of discussions, of negotiations. And I think what's come out of it really is a very rich debate, rich discussion, and something that actually hasn't probably been fully captured in any one document, and certainly won't be captured in the post-2015 agreement. So it's important, I think, when thinking about post-2015, to think of it broader than just the pieces of paper that come out of it. And I think it's exciting that people with disabilities have been central to that discussion. I think it's beyond 2015, and also working for a disability rights NGO. It's amazing to see how those two things have come together, how the disability rights movement has been so strong in the pan-civil society movement. And I think that's something that we should celebrate and continue after these negotiations have finished. So we have the zero draft, it's very exciting, of the post-2015 agreement. We have discussions around the indicators, and we have the discussion around implementation, particularly the financing for development in the Addis conference that the Minister mentioned. People with disabilities and rights of disabilities have been mentioned and referenced throughout many of those documents, and that's really good. But I think there's a real challenge for us to make sure that those aren't just references, that they actually lead to change and to action. So Sightsavers priorities are around, as I said, disability, also data disaggregation, which was mentioned. We work on neglected tropical diseases, on universal health coverage and universal education. And Beyond 2015 is about the voice of civil society within that process. So I'd like to maybe start mentioning Ireland's leadership in the process. It's great to be here in Ireland. And Ireland have co-facilitated the negotiations. And one thing to mention about those is that they've been incredibly participatory. And that's one of Beyond 2015's priorities, and also, the wider civil society. And to see that civil society's had a voice in that and been seen as an important stakeholder is really important. And Ireland has been a consistently strong voice on the need to involve the voice of civil society. And it's been one of the most participatory processes that the UN system has ever had. So I think we need to recognise that, and to recognise that whatever outcome comes from it, that it's had the voices of many people included within that. And we need to maintain that level of participation through the next stage, but also into the implementation of the agenda. It needs to be seen as the agenda of the world and not just member states. And so, yeah, welcome the work that the co-facilitators, Ireland and Kenya, have played in that. Also, I think it's important for us to welcome the Zero Draft, which I'm sure all of you have read many times. But yeah, it's the culmination of a huge amount of work, as I've said, many years for most of us. So it's something that's that should be seen as a culmination of that. So the declaration that accompanies that agreement, that needs to be ambitious, and it's good that there's the beginnings, the germs of some ambition within that Zero Draft that we can build on. I think it is fair to say that it is missing the strength of human rights language, and that's something that I think we need to push on, because it can't be a race to the bottom on human rights. You can't kowtow to those states who want to take human rights language out of there, and that's obviously very important for the disability movement, the disability agenda, because human rights and development, seeing those two things as two sides of the same coin, has been really important, as Catalina mentioned. There's a commitment in there to leave no one behind, and that's seen as a central principle. But as Catalina also said, it's important that that's defined as ensuring that no target is considered met unless met by all economic and social groups. As people with disabilities are excluded from the MDGs, and therefore from all the progress under the MDGs, it's essential that attention is focused on discriminated and vulnerable groups first and foremost. It's not an added extra aside that you put on. So that's something that we need to work on. Disaggregation of data is critical, but it's also really hard. Australia's government estimated that only 3 to 4% of people with disabilities benefit from overseas aid. But we don't really know. No one is counting. So we need to balance sustainability, human development, poverty eradication, good governance. That's what makes the SDG agenda great, is that it covers so much. But it can't be a reductive compromise. And that's got to be a real focus and something that we, within this community, also work on. I just want to briefly touch on implementation. There's a statement that what gets measured gets done. And I don't know who said that. I think it's been attributed to everyone under the sun. But I think that doesn't make it any less true. It's essential that we get the indicators right. But it's been a bit of a mess, frankly, this indicator process. And that needs to get sorted out. Where it mentions disability within a target, we need to measure disability within the indicator. And that's not happening. And so, again, that's a real concern. Financing for development, another huge concern for us. The agreement will be reached in Addis, hopefully, but it doesn't look like it's going to go anywhere near enough. And countries need to commit to financing and funding this agreement in a way which is more than just before. It's a huge shame, frankly, that we're still talking about 0.7. That was supposed to be reached a long time ago, but we're still talking about how great it is that countries have made a commitment to 0.7. Frankly, they should have reached that. We should be talking about 1% by now, I think. And so let's push on that, because until richer governments meet their commitments, then it's going to be tough to see any real progress. And countries need to show political will to implement this agenda. And Beyond 2015, as a campaign, has decided to focus more on governments and their commitment to post-2015 and develop comprehensive implementation agendas. We've facilitated conversations between governments on this, and Ireland have actually been quite a good example of that. But for Sightsavers and NGOs, and I know a lot of us in the room, that's going to be a real focus going forward, to working in all our countries that we work in, all our country offices, to increase the national awareness of this agenda, to transform it from paper into action. And I think that's something that we should all be talking about, and you guys should be talking about throughout the week, is how to transform this agenda from paper into action. And Ireland, just because I'm here, just to mention that I think it would be important that Ireland, as part of that, ratifies the UNCLPD. That should form the basis of a systematic approach to disability. So leave that in the room for you to discuss. I'm sure it'll come up a few times. So like I said, to conclude, it's excellent to be here, to be among so many great minds. I look forward to the outcome, and I wish I could be here for the whole week, absolutely. But Post-2015, just remember, is a voluntary framework. It needs consistent action for the next 15 years to make it a reality, to make what is on paper become a reality. So really, we're not even at the beginning yet. We're just at the end of the summary. So let's think. Let's keep that attention, that energy on including disability inclusive development for the next 15 years, and hopefully we'll get somewhere. So thank you.
I think we actually are on time to actually have our coffee break at 11, so I think that's pretty good going. I know that our speakers sort of questions and answers are available during the coffee break, so feel free to come up and ask questions and say hello. So thank you everyone for your attention this morning. I know it's been a